Hey everyone, Johnny here with OhioCannabis.com. I'm in Dublin, Ohio at OhioMarijuanaCard.com's office here with Dr. Julianne Moy.
Yes.
Nice to meet you. Thanks for having us.
Nice to meet you. Thanks for having us.
Yeah. Now this video is sponsored by OhioMarijuanaCard.com. They have 5 offices right now. They're a great group of people. They're working hard to get you guys appointments with all the doctors throughout Ohio. They've hired about 20 people, so they're really doing a lot, throughout Ohio. They're at a lot of different events. Just a great group to work with, and they're really trying to make this process as smooth as possible for you guys. So once again, that is OhioMarijuanaCard.com. So with that said, tell us a little bit about what got you into wanting to be a marijuana doctor in Ohio, because you were one of the first.
I was, yes. I went to medical school in Southern Ohio, at Ohio University, and I ended up doing residency Southern Ohio, sort of city rural area, and of course that's sort of the heart of the opioid epidemic in Ohio, actually in the country. So throughout my residency, throughout working in the hospital, I saw lots of people, addicted to opiates, a lot of similar stories. You go in for a surgery, you have an injury, doc gives you opiates. It works great. Still have pain after surgery. Years go by, we're on medication, and then, the government sort of changed the rules, and medicine sort of changed in general, where we said, oh no, we can't just keep giving everyone opiates. Now everyone, realized that that's not the best approach. So we have doctors trying to take away the opiates from patients that need it. We have people, unfortunately, addicted to opiates who can't get it anymore, and there's just, it's a chaotic, it got messy, so I just saw that firsthand. And, marijuana can be a good transition off of chronic pain medications.
And I think that's the problem, is that these people have been cut off from this medication, and they don't have any other alternatives other than going to the street drugs.
Right.
And that's obviously a lot worse. So this marijuana is needed in so many ways.
It is, absolutely,
for relief and as a transition to just a better life, What kind of, we have 21 ailments in Ohio. Have you seen a majority of some, one type of ailment, or is it all over the map?
It's a little bit of everything, but a vast majority of people do come in with chronic pain. There's a very big umbrella of diagnoses under chronic pain, from people that have chronic low back pain to people that have chronic migraines, things like that. A lot of those issues, as well as a lot of folks, especially veterans, coming in with PTSD symptoms. And fortunately, that's something that has been studied a fair amount in terms of having marijuana or cannabis having benefits for PTSD treatment.
Yeah, I seen something that the veterans got another chance maybe at marijuana under the VA. So
yeah,
we'll see. It was sad because they had gotten it approved a couple years ago. I don't know if you know, and then they took it back from them.
They did, yeah, and I know they had it. It was supposed to be, voted on. I don't know. I didn't keep up with the news, but it was recently, trying to get back into a bill where, doctors working with the VA would be able to prescribe cannabis.
Mm-hmm. Yeah. Now, I got a few questions here that I want to make sure I ask too. So, tell us a little bit about. So what ailments would you like to see added that aren't on there now?
Oh, let's see. Well, absolutely. We have tons of patients come in with anxiety, depression. I think there's definitely some therapeutic avenues for that treatment. As well, insomnia is something that a lot of people come in for. And, sometimes that kind of goes hand in hand with PTSD and other symptoms, but I see people who come in individually, and unfortunately you have to say, oh, we're sorry, the only real psychiatric diagnosis that we can give you a card for is PTSD. So that's something I think I think a lot of psych diagnoses have some good, marijuana has some good therapeutic remedies in some of those.
Especially compared to like Ambien or something,
Right.
Talking about insomnia, where that's a bad drug,
Exactly.
People, it's needed in some cases, but the side effects are bad.
A lot of the sleep drugs are, in medical speak, they call it like the Z drugs, a lot of the Z sleep medications, which when they came out were amazing, and then again, a lot like opioids and benzodiazepines, we realized, we can't be giving this to somebody for years upon years. It's something we're supposed to give for, less than a month. So we kind of are at an impasse in those kind of medications as well.
And that's where a regulated market's going to come into play, because you can get an indica that is going to make you sleep a lot better and keep you calm at night, and maybe have a sativa for the daytime or a hybrid. So a regulated market is so important for people to get the right strains and the right access that they need on everything.
Right. I definitely agree on that. A lot of folks come in and they're, when we give them a treatment plan or start talking to them about the different kinds of marijuana, they're just blown away, because it's not just weed. It's not just, is it the brown one? Is it the green one? And, and we can say, there's hundreds of strains that when you go to the dispensary, your head's going to explode, because they'll be able to point you in the right direction to, if you want an edible, if you want a tincture, if you want, something for sleep or something for the daytime. You don't just have to get whatever Joe's selling that week, that kind of thing.
Yeah, that is important. Now, do you... right now, you can make dosing recommendations. You're not making strain recommendations or anything right now, because there's none that are known at the moment.
Correct, yes. That's kind of one of the things that I and a lot of the doctors are looking forward to. We have patients that they want to know exactly, where can I go to this dispensary, pick up this exact, strain or this exact amount. Because that's what people are used to. They're used to a prescription, I take this medicine 3 times a day, that kind of thing. So, yeah, definitely something to look forward to when we do get to develop relationships with dispensaries, so we can say, if you go to this dispensary, they will have this product for you, so they don't have to worry or wonder about, what that's going to be like when they get there, that sort of thing.
And, people can do strain reviews on the website or on the internet in other states, but until you have it grown here where, all growing conditions are different and everything's just going to be a little different, we need access to the strains here in Ohio to really know how it's going to affect people,
Right,
This is a new medication that is going to be slightly different than in other states, and we need to see how it's going to affect people the right way.
Yes, I completely agree.
So right now, obviously, the patient portal is not open, but you are accepting patients to be seen, which is a good thing, because it's going to help clear the backlog.
Yes.
Are you guys setting up like a follow-up at any point after this first visit right away?
Well, currently the state regulations call for a 90-day follow-up. I think that they've kind of relaxed it since they're kind of, back behind in terms of the dispensaries opening. They're going to, or we are going to start doing our follow-ups via telephone 90 days after the first dispensaries open. So then by that time, we would assume that patients would be able to get the products that would be available at those open dispensaries. And those are via telephone. One of our physicians from our offices will call, see how things are going in terms of treatment, fill in any questions that they might have, and then hopefully at that time we'll also have more information for them, in terms of strains or dosing, or if they have any, questions or confusion about that as well.
It's going to be continued care,
Absolutely.
This is definitely this is a new ballgame that you guys really have to see how it's going to affect everyone. And are you making recommendations on dosing right now then? Or?
Dosing, not really, just maybe the only real dosing that I give really more caution to is edibles in terms of dosing, just because those are kind of tricky to dose, and of course edibles are always something yummy. It's not like broccoli THC, it's always like a candy bar. And so I caution patients that I say between 5 to 10 milligrams per 100 pounds. And a lot of the things that they sell in terms of like candy bars, brownies, that's like 100 milligrams of a brownie. So you're not used to eating a square of brownies. So that's what I caution people against. Not to gobble down the whole thing and take time and wait an extra 45 minutes to an hour before taking another dose, that sort of thing.
And it's hard because I personally like the flavor of marijuana and edibles. I think it adds a really good flavor. But have you noticed any concerns that patients are coming in with a lot right now? Legal concerns, or maybe they are worried about taking too much? And
a lot of folks, actually, a lot of people have, I think, that have come in, they've kind of exacerbated all of their options in terms of medications. So I think they know, since marijuana is, a natural plant, they're not that concerned about overdosing. In fact, there's never been a case of someone overdosing on marijuana. A lot of people are more concerned just because it's kind of like we're at the last mile of a marathon. 2016 came, they passed the bill, everyone was so excited. We didn't get the ball rolling, till honestly, earlier this year.
Yeah.
So now we're again sort of waiting on what's going to happen with dispensaries. And it's unfortunate because there's a lot of people out there that need it. Right now they would love to leave our office, go to a dispensary. Cancer patients and things like that. That been waiting, and time is limited and pain is chronic, and it's unfortunate. So that's what they really want to know, when they can get their hands on the products, when they can talk to physicians about getting a really hard set treatment plan.
Yeah, that's a good point. Well, I think that's about all I have today. Is there anything else you wanted to add, or?
No, I thank you guys for coming in. We're excited. We're a fast growing company, and we're just
It's the new office, right?
Yeah, we're in our new office here in Dublin, and this is actually temporary. We're moving across the hall to a bigger space. Okay. So we're really excited to be here, and hopefully set some roots down, and ready to see patients.
Yeah, great. Now, are you handling questions through email or anything, or is the?
We do have a Columbus email, and our office manager takes care of those. Any medical questions beyond her scope, she shoots them over to me.
And that is, I think it's Columbus at
Ohio Marijuana Card. Yep.
Okay. All right, perfect. Well, we appreciate you having us out here, and we look forward to working with you and Ohio Marijuana Card more in the future.
Awesome.
Thank you. See you guys. Bye.